hygiene is a really important thing that we need to concentrate on right from birth. Babies are born healthy and they're not born with ear infections, or any infections really, until down the track when they're exposed to infection if they're not getting their breast milk. So we need to be really careful about hygiene and teaching young mothers to keep their babies bathed and clean. Glue ear happens through poor hygiene and not being breastfed. Babies need lots of breast milk for that protection, and they need really good hygiene to protect their ears. When babies are born, they do a lot of breastfeeding, and part of that breastfeeding is using their jaw right back. It uses their ears as well as their jaw, so they're really opening their jaw back to their ear, which helps develop strong muscles and strong drainage to do with ear health and jaw health. This is a picture that we show the mothers when you come into hospital to have your baby, of how the baby's jaw works, and it works right back to the baby's ears, and the little baby's ears wiggle. So you can see that they take a lot of breast right back to the back of the throat, and then they use their jaw to draw that breast milk off. And that's part of developing nice strong ears and preventing ear infections. Very strong part of. It's very important to breastfeed for young babies for the protection of against infection. Mothers need to be very healthy as well, so that what they're eating is going through to their baby to make them a strong, healthy baby. And the breast milk is protective for infections all over the body. So for ear health, so they stop getting that pussy ear, glue ear. In particular for young children, ears, lungs, for chest infections and gut. They're very immature babies, and in the first 6 months especially, they just need breast milk to give them protection every day, every feed. The book that we have developed on the ward to show the mothers when you first have your babies is a story all about strong women, strong babies and strong culture. And it shows picture by picture the importance of breastfeeding your baby and keeping your baby's ears healthy and body healthy and strong. And it's a really good story to have a look at. In the early months, babies need to grow quite quickly, and it's really important and that's when they're the most susceptible to ear infections and chest infections and gut infections. So they need to go to the clinic and make sure that the nurses and doctors are checking the babies and on their growth charts, and that the babies are growing as they should. At 6 months, it's really important that babies are then introduced to food, with mother's breast milk helping to support and keep fighting infection. So ongoing breast milk and feeding of mother's breast milk is protective for the first couple of years of baby's life, while they're learning to eat food once their tummies are big enough to tolerate good tucker. The baby is receiving antibodies against that cold from the mother through the breast milk. So the baby needs to continue to breastfeed, keep that nose clear, and keep checking the ears, and that makes sure that they're not getting an infection back through their ears. But with breast milk, that actually is like a medicine to the baby's ears to keep it clear and stop it getting an ear infection. It's very important for mothers and babies to be up to date with their vaccinations to help those babies develop a good immunity. The mother passes through whatever she's been immunised with through her breast milk to the baby, and then throughout that first year, because baby's immune system isn't strongly working by itself, then they need to have their immunisations, which start at 2 months. They start at birth in hospital, and then again at 2 months, 4 months, 6 months, and again at 12 months and beyond. So it's really important that mothers keep up to date with those to help those babies not get infections, and that they keep breastfeeding so that the mother is giving them some of her immunity from her immunisations through the breast milk to the baby.